there, welcome back to my channel. My name is Jamie Kate, and that's me welcoming myself back to YouTube because it's been a while since I made a video, but here I am. And in today's video I'm actually going to talk about my new Grad RN residency program. Okay, let me check it because I don't even know what my last video was. Okay, so my last video was actually how I successfully transferred my RN license from Hawaii to California, and this was 6 months ago. So it's been 6 months since I last uploaded, and a lot has changed. I am now an RN, and I'm getting used to working as an RN. I'm getting used to the role and my responsibilities, so I really had to give up YouTube so that I can focus on that and learn as much as I can while I'm in the new grad program. I feel like this video is going to be long because I will be sharing with you how I started, what are the pros and cons, and also I'm going to share some tips on how to apply and also how to survive the new grad program. So maybe you should get a drink or a snack so you can hang out with me for a while. So I got my license last year, December 10, 2018. As soon as I got my license number, I was just searching for job opportunities online. The thing with looking for new jobs is that you don't get interviewed right away. It takes weeks to actually get a call from companies. When I got my California license, I actually did not apply to jobs right away because I planned on going to the Philippines for a month. So I didn't want to apply yet because I was scared that if they call me back, I am not available and I won't get hired or get offered a position. But I already searched for different job opportunities, and I came across 2 new grad programs that will be opening soon. So before my vacation, I actually prepared my requirements that I will be submitting for the new grad program. I asked 2 of my bosses to write me a recommendation letter. I asked a coworker to write me a recommendation letter. I already made my letter of intent and I updated my resume so that once the application period opens, my requirements are ready and all I have to do is just submit it. So I was in the Philippines when the application period started, and so I submitted all the requirements online, and I didn't get any email or I didn't hear from them for a whole month. So when I came back to the US, I was still working my LVN shifts. I think it was around the 2nd week of March when I received a call from a recruiter. She told me that she can schedule me for an interview, but not in the department that I actually chose on my application. So when I applied for the new grad residency program, I actually chose ICU, ED, and PACU. So the recruiter called me and she told me that there were no positions left for the ED, for the ICU, and for PACU, but she can schedule me for an interview at the subacute unit. I work in subacute, so of course I would say yes to interviewing in the subacute unit. Just to clarify, when I was applying for the new grad program, they didn't have subacute as an option. So I was actually surprised that they scheduled me to be interviewed at the subacute unit. I also remember my recruiter told me that not because I work at subacute as an LVN, there's no guarantee that they will hire me as an RN because there are 7 applicants that I have to compete with. So she told me that I should do my best during the interview, so that's what I did. So out of 7 applicants, they chose 2 RNs, and 1 is for day and 1 is for night. And I was fortunate that I got the day shift. I actually got an offer for the position the very next day of my interview. Orientation started around April. I worked my very last LVN shift 3 days before the orientation. So I transitioned from being an LVN to an RN. The whole April is actually focused more on classroom orientation. It's more classes and also teaching us the basic skills that we need to know before we start working on the floor. After learning how to chart on Epic, we were scheduled to do our floor orientation. I was assigned in acute rehab for 10 shifts where we get 5 patients or 4 patients per nurse, and most of the patients there are alert and they're recovering from either surgery or just transitioning from hospital to home. I personally like my experience in acute rehab. I feel like that is something that I can consider. So then I transitioned to the subacute unit. But before I started my RN orientation, I actually did 2 shifts with the wound care nurse. I actually learned a lot from that experience. I learned so much about what medications to put, what works for elderly patients, what dressing to use. So in subacute, our patients are mostly trach patients and ventilator patients. Even though you have 21 to 22 patients, you have LVNs who pass meds, and you have CNAs who help you with getting the patients ready for the day. They also help out with repositioning and turning the patients. And you also have respiratory therapists who take care of the breathing treatments and check on the ventilators. So as an RN, it's mostly managerial position and making sure that you keep up with the appointments, you make sure that they are in stable condition, you communicate with the physician, give IV medications, and do blood transfusions. So overall, my experience as an RN has been manageable. For now, I say that. I feel like my LVN experience allowed me to transition to the new role as an RN to be easier and less scary. I still struggle with time management from time to time, but I have been implementing good habits to make me more efficient and effective as a registered nurse. So it's been 6 months since I started my new grad program. I feel more confident. I'm getting used to the workflow. I still stutter when I talk to doctors, but I just follow the S-bar and call it a day. So let's discuss the pros and cons of the RN New Grad Residency program. Let's talk about the pros. The first one is that they teach you everything. Part of the classroom orientation is that they teach you about different disease process, how to assess the patients, how to manage the disease, and when to call the doctor. We also had simulation classes where we work with actors that act as a patient, and there's an actual case that you have to resolve. And after that experience, we do debriefing and they discuss how to effectively approach the case. And it's just a very caring and a good learning environment where you are not judged for making a mistake. They provide constructive criticism, and that takes away the anxiety of just being a new grad or just being a new nurse. And that's what I like about the new grad program, is that they teach you everything so that you don't feel overwhelmed. I've had an experience before as an LVN where I got hired and I was just given 3 days of orientation and I didn't feel safe caring for the patients, and every day I was just so scared that I will lose my license, and that is not a good feeling. With the new grad program, you get to learn everything first before you start working on the floor. The second pro of the new grad program is that you get longer orientation shifts. Overall, I had 31 shifts of orientation, and that lasted for a good 4 months, and that was such a huge advantage for me because I get to learn everything. I was paired with different preceptors and I got to learn their good habits that now I implement in my practice. So during that long period of orientation, I got to learn more about my patients and also their families. I also took that opportunity to learn more about inserting IVs. During my orientation period, I always volunteered to draw labs and also start IVs. Now I'm on my own and I don't have to ask anyone for help, unless, of course, it's a hard stick. Another pro of being in the new grad program is that you get paired with well-seasoned nurses. I appreciate my preceptors so much. They've been working in subacute for years. So I learned so much about different techniques, how to talk to doctors, how to talk to patients, how to talk to family members, how to manage my time, how to be efficient. I find that helpful because they've been working for a long time, so they already know everything about the unit. And I think that is very helpful, especially for new grads like me. Of course, not every program is perfect, so here are some cons of the new grad program. First one is that the base pay rate is low. If you are a new grad and you are very excited about earning RN money, let me be honest with you, the pay is not high. So if you are expecting to earn around 40s or around 50s, I'm sorry, you'll be disappointed. However, I didn't treat this much as a con because I work as an LVN and my rate as an LVN is lower than my RN rate. So for me, it was still a pay increase, and that is an advantage. But if you're a new grad and you have no prior experience to this, and this is your first adult job, and you went to a very expensive private school, I think you will be disappointed with the pay. And this leads me to the second con, which is you don't get paid enough the first few months. Since you are doing classroom orientation and also floor orientation, you can't have overtime and you can't work 3 shifts if you have classroom orientation. Some months we would have classroom orientation and I can only schedule 2 shifts per week, and my hours per pay period would only be around 50 to 55 hours. So that means you don't get paid the whole 72 hours, which means less money for you. And again, since this is a pay increase for me, I didn't have a lifestyle inflation. I was technically earning as much as I was earning as an LVN full-time. I was able to survive and pay my bills until I was on my own and I was working 72 hours. That's when I saw a difference with my salary. And the last con is that the new grad program is highly competitive. The thing is, not every hospitals offer a new grad position. I think that's why new grad programs are a 6-month to a year commitment, because they are spending so much money educating you and training you to become a very good RN. It is highly competitive. That's why your application needs to stand out and you have to ace your interview. So let me share some tips on how to get into the new grad program. So the first tip is to build a resume that stands out. You will be applying for this position along with thousands of new grads, and the least that you can do is make sure that your resume stands out. Make sure it's clean, make sure everything is grammatically correct. You have to make sure that the information is accurate, and you have to put people on your reference that actually know you and your work ethic. Don't just put your significant other, your friend, your best friend, or someone you just met. You have to put people that can actually talk about you. People that you've been working with for years, your co-workers, your supervisor. Just make sure that they know you very well. I used to think that companies don't really call whoever is on your reference list, but some of them do, because then it will look bad if they sound unsure when they get asked about you. So that is why it is important that you build a good relationship with your boss, with your supervisor, and also with your co-workers, because they can make or break your application. The second tip is to apply to as many new grad programs as you can. Don't limit yourself to only one new grad program, because like what I said, it is highly competitive. You don't want to get disappointed when you don't get selected for the new grad program. The new grad program is not the only option. There are so many fields, areas, and units that you can work at. If you don't get into the new grad program, that is okay. You can apply at a skilled nursing facility. You can try out home health. You can also try hospice. There's so many options. So don't limit yourself to just the new grad program. The third tip is that you have to know your strengths and your weaknesses. You have to have an honest conversation with yourself. Know your strengths. What are the things that make you a good nurse? What can you offer your employer? What are your set skills? You have to know what are the things and areas you are good at. Enhance those skills and educate yourself more. You also have to be honest with yourself and know your weaknesses. My weakness is that I get anxious when it's time for me to delegate. I don't like the feeling of telling people what they should be doing, and sometimes I just keep it to myself and try to do the task on my own. I don't know, it's just me. I get anxious when the person I'm communicating with gets upset or complains about the task, and that is something I am trying to improve, because in order to be efficient, you have to delegate. You have to delegate your task. You can't force yourself to do everything because otherwise you will be burnt out and you cannot finish important tasks and things that you need to do as an RN. So proper communication and delegation and also being firm are things that I am trying to improve right now. Now that you learn more about how to get into a new grad program, let me share some tips on how to survive the RN residency program. Number one, during orientation, volunteer as much as you can. During orientation, I kept on volunteering to do the lab draws and also starting the IVs. When I was starting out, I was just having a hard time starting an IV. What makes it harder is that most of our patients are hard sick. So that is why when I was on orientation, I would volunteer as much as I can and I got a lot of practice. The second tip is to build good habits. You have to have a good plan on how you are going to tackle your day. Every day, my routine is that I make a checklist of the tasks I need to finish. I list down the lab tests of my patients that I need to watch out for. I also check if all of my patients are assigned to a CNA and to an LVN, and I make sure that I endorse every single patient to each CNAs and LVNs. I introduce myself. I let them know that I am the RN assigned to the patient so that if they need help, if they need to report something, they know who to look for. And this leads me to the third tip, which is to have a good relationship with your CNAs, your LVNs, and your RTs. You have to have a good working relationship with them because it will make your life easier. You have to be respectful, kind, and helpful to your coworkers. Even if the patient is not assigned to me, I answer call lights, I check ventilators. I always do my rounds and ask my coworkers if they need any help. If the CNAs need help with pulling up a patient, I go and help them. If the LVNs need supplies, I get it for them. You have to remember that even though it is not part of your job description, their patients are still your patients. As the RN, you are responsible for them. So that is why it is very important that you build good relationship with your coworkers. And that is all I have for you in today's video. I feel like I talked too much in this video, but you know, I actually miss doing this. I actually miss making YouTube videos, just sitting down and just blabbering about my experiences as a nurse. I know this channel is mostly known for the minimalism and the zero waste videos, but I also want to incorporate nursing videos because that is also something I'm passionate about. Honestly, I have so many topics that I want to start discussing, and I have exciting news for you guys. So I'm really just trying to manage my time very well, and hopefully if I get that under control, I can make more videos for you because I've been doing big, great things that I am so excited to share with you. For now, I hope you liked today's video. If you haven't subscribed already, I would really appreciate it if you click the subscribe button and leave me a comment. So see you in my next video. Bye!